I'm Teresa Weber-Sexton. I'm 34 years old, and I've been a patient at Mayo Clinic for the past 11 years, but have been seen in the Department of Cardiology for approximately 4 years now. My story goes back to actually my childhood days when I knew that there was something a little different about the way my heart was operating, but couldn't quite identify what it was. And there was always just this extreme amount of extra beats or rapidness that I felt in my chest, and there were, on occasion, I could actually look down and see my heart palpitating through my chest, even at points or moments in time when I wasn't anxious. And I remember vividly one evening looking at my younger sister and asking her, as we were trying to go to bed, if she had ever experienced anything similar to, hey, have you ever had your heart kind of raised, or have you ever felt extra beats? And when she said no, I quickly dismissed it and said, yeah, neither have I. And so several years went by, and it wasn't until I was in my late 20s and had just delivered my first son, and in the middle of the night, 2 o'clock in the morning, an OB nurse came in and was checking my vitals and said, has anyone ever told you that you have extra beats? And I dismissed it and said, no, I've never heard of that. And so she said nothing more, and nor did my physician after that. So we kind of went on, and a few more years went by, and I was in to my allergist actually, and my allergy medications weren't working, and I needed something different. And so he wanted to prescribe a particular medication, but was cautious because that particular medication had some different side effects, and so he wanted to check my vitals. And when he was listening on that particular day, I felt that he was listening for an extended period of time to my heart, and it kind of made me nervous. I felt that there was some reason as to why he was listening so long. And when he was done, he said, has anyone ever told you that you have extra beats? And I said, well, actually, yes, you're now the second person. And so before he was willing to prescribe that medication, he said, well, let's kind of look and see where they're coming from. So I believe within a day or two, I was in having an EKG and an ECG, and it was determined at that time that I had extra PVCs, or extra beats. And at that moment, I think I was about 18,000 extra a day. And so they told me my number, and I wasn't, alarmed by that. I mean, I knew that it was something extra, but they also said I had mitral valve prolapse. But it was very mild, and so the protocol was that we were just going to watch it on a yearly basis, and I would check in with my cardiologist, and so we did that. But at about the same time that that was happening, I've always been an anxious person, or at least that's how I identified myself, but during that period of time, I felt like my anxiety was really starting to increase. And I didn't know if it was because it was kind of like that, what comes first? Was it the anxiety that was causing the extra palpitations, or the palpitations causing me to be anxious? And so in year 2, I went back in, and my PVCs had increased to, I believe, about 22,000 extra a day, based on my Holter monitors. And again, my anxiety was starting to go up. And in year 3, when I went in, I was up to almost 30,000 extra PVCs a day. And my anxiety was probably at its all-time high. And there were nights when I would be in bed and my heart would start racing so fast. And it was just the intensity of the pounding that was abnormal to me, that I would actually lay in my left-hand side and I would hold under my arm against my heart and take deep breaths to try to get it to calm down. And at moments feeling like I was having a heart attack or an anxiety attack. And at that moment, my cardiologist recommended that I meet with a surgeon to look at doing a procedure called an ablation, whereas he identified it or described it to me was that there are areas in your heart that are supposed to beat in order, and that there are some that just decide to be kind of rebels and misfire when they're not told. And so the goal was to hopefully go in there and find those areas and burn those through this ablation. I actually made a point to meet with a couple different surgeons. So I met with one surgeon and went over the process and got their points of view, and after that we opted to meet with another surgeon just to make sure that we were all on the same page and that people were recommending the same procedure, etc. And so we met with another surgeon, and the one thing that was really comforting about the individual that we chose was that he had said, I don't think that it's any of these other issues, but let's go ahead and test them all. So we did urine analysis and additional blood work, trying to make sure that we weren't jumping into a surgery or a procedure that was really not the cause of my extra PVCs or arrhythmia. So that was reassuring, knowing that the day we went in for surgery that we had ruled out everything else and that the ablation was what we needed to do. So I guess one of the reasons that I mention that too is because I think for patients it's important to not only do your research, but make sure you feel extremely comfortable with your surgeon. And we found that at Mayo. And there's lots of different physicians that communicate information in different ways, but shopping around and making sure that you feel comfortable and confident. After meeting with a few different surgeons and really weighing the pros and cons of it, and then after learning that there was some research or some thought behind that people with these high numbers of PVCs also experienced large amounts of anxiety, and because we were also trying to find different anxiety medications that would work for me, and I was currently on some, when I found out that for many patients that once the surgery is conducted, then they no longer need to be on anxiety medication, that was a huge selling point for me. So I thought it's worth it. So if it doesn't work, it doesn't work, but if it does, my life will be so much different. I was also extremely fatigued and just other physical things that I thought, this can't hurt. So we went ahead, and in 2009, I went ahead and did the ablation, and they were able to pinpoint, they felt kind of the culprit or the main area. I'm not exactly sure how many areas they burned, but it was successful. The Holter following that showed 0 PVCs immediately after the surgery. And when I conducted my 1-year appointment, there were a few additional which were really insignificant, and everybody has some at some point. But for me, the biggest thing has also been within 3 months of the procedure, I started to taper off of all of my anxiety medicines, and at this point, 1 year later, I haven't had to be on any. So I believe firmly that the ablation, well, it helped in so many levels. I have a lot more energy, I'm not anxious, I no longer have to take moments to lay on my side and try to get my heart to slow down. I'm a better mom, I think I'm a better employee because I'm not having to miss work because of it, and I know that I'm just happier. And they said that I would notice right away how horrible, I guess, if you will, I felt prior to the surgery, and not even realizing how tired I had been or didn't feel well, and I was like, well, we'll see. And it was true. Within days after the recovery process, I felt like a completely new person. So I guess for me, anybody that is kind of thinking, do I do it, do I not do it, for me, the pros were so significant that it was a pretty easy question to answer that I would do it.